Hi everyone and welcome. I'm Dr. Eric Bunge, and we're going to be going over the instructions that I found work really well with the R1 units at home. I have a Theralite bed, I use Aspen laser, we use transcranial devices, and all these elements of red light therapy are wonderful, and now we have something we can use at home that's not only powerful, but we can adjust the power and we can get multiple points. So we're going to go over the different sets of instructions for that. And we have our R1 unit right here, and it's really wonderful. Some of the benefits that are unique to it is that not only do we have 4 wavelengths, the 600 nanometers, 2 800 nanometers, and 1 900 nanometer, but we can adjust the power output. So we can, with a push of the button on the back, we can go from full power down to a much lower power at 10 hertz, 40 hertz, or 100 hertz. And we can reduce for the intensity for more sensitive skin. But most of the time, we're going to be taking it back up to 500 hertz, full power, because it reaches the deepest. And we're going to be talking about neuropathy and muscle pain, not only treating our lower extremity and our legs, but our chest and even our head and face. To begin with, protect. You see I wear glasses. We don't want to be looking at that red light therapy a lot. A little bit's okay, but do keep either some kind of blockout glasses or specially made glasses when it's on. If it's aimed straight at your face, do keep a set of real blockout ones like this, which is what comes with it, and that way the eyes are totally protected when it's aimed right at your face. Simple $1 eye shields work really well in the bed and work with this too. There are some times you do want to protect things. Say you had a recent boo-boo, so you get a piece of kind of tape or a Band-Aid that's made to come on and off the skin and do protect them. You can also move it farther away or turn the power down if you are sensitive. Some people who are pale skin, a lot of blood thinners, they want to turn the power down for the first 2 weeks and also reduce it to 5 minutes. You'll feel the warmth, okay? And if it starts feeling a little too warm, that's when you know I've had enough. And so the next time you'll turn it down or move it farther away. And we are thinking usually about 6 inches from it, but 12 inches is just fine. You can see that it doesn't diverge as much. It's a very powerful beam, so that 6 to 12 is the therapeutic range. And just sometimes we might want to turn it down in power or reduce the amount of time we do. So we protected things. You can use a cream that's specially made, a Band-Aid, any kind of cloth material if there's something to protect. Perhaps you have a lot of varicose veins in a region. I would pull them farther away, the 12 inches, and try 200 or 300 hertz, and you'll still feel it just slightly warm, but it won't be uncomfortable or anything. So we are going to protect everything, and we do know that we can adjust the power, and now we want to talk about the number of points we want to interact with. If we're doing anything that's involving the nerves, such as neuropathy or poor reduced circulation with aging, we want to start towards the middle and then work out. A lot of times I'll start with the low back. So here I can pull my shirt up and pull my pants down and turn the unit on. And say I want to do neuropathy in my feet right now. Okay, I'm going to start with my low back, and I'm going to give it 10 minutes. And again, I'm going to be at about 6 inches from it here. Okay, and it'll feel slightly warm, maybe about 94, 95 degrees, but it shouldn't get hot. And I can just warm up the nerve bodies, because the nerves for the feet actually have their bodies here, and then they travel down through the sciatic region and the leg and the lower leg to the feet. So we want to give them some therapy here, and a good 10-minute dose warming them up several times a week is a good idea. Let's go ahead and continue with the neuropathy to the feet, and we're going to do the upper leg. So here we are working with the upper leg. Now it's got a little bit of benefit to the knee, but the main thing we're doing is this track right here, the neurovascular bundle coming out of the sciatic region, going down the leg. So we can add 5 to 10 minutes here. We've seen benefit to testosterone and production by having it red light therapy in your gonads. It's also a little bit on your belly, red light therapy. In addition to removing and benefiting inflammation and pain, it helps with get the energy system working in your body, and that energy system helps burn calories. So red light therapy, especially these concentrated ones, reach and help with visceral fat. The epithelial function, that's our circulation, okay, and that's very important. That's when, like I said, this neurovascular bundle right here is very important. So after this, we'll go down to our lower leg, okay, and we can add, you can see there, I'm a little bit less than 12 inches, but not quite 6 inches close. And then finally, we can add our feet. Now the feet are a little different here because they tend to hang at an angle. Okay, see how when I hang my feet off, they hang at an angle. Okay, so again, sometimes we'll get a little closer, and that seems to be fine with folks. The light's now shining right at her face, which is kind of bright and difficult to work with, so we can add a pillowcase. And we can use the pillowcase as a shield. And so now we've got the red light therapy blocked from our upper body, but yet we're treating our feet. So we started with our back, we did our upper leg, our lower leg, now we're working with our feet. And sometimes our feet will hang closer, they'll get, we've noticed folks, you know, even as close as 3 inches away, and it seems to be pretty comfortable for them. The feet are nice and thick, but we have those higher wavelengths to reach through. So next, let's look and see what other body parts we can do. So we can add it to a knee, okay? And here I am just getting it about 6 inches away, full power. We can do the inside of a knee. We can come up here and do a shoulder, okay? I showed this doing a lower back a minute ago, but if it was a little higher, let's talk about upper body posture and relaxing things. So we know we have chronic inflammation up above here, and we want to relax it. And so while we're doing this, we can do posture exercises to relax our shoulders and neck. We can put it closer to our head, even up here. That's what we'll do here. Put it closer to our head. And you see how bright it is, and get close to it. Pretty close to wanting to wear glasses here. I can do my whole upper neck and low back, all these muscles that are really tight. I usually do posture restoration exercises, so we're trying to exhale and stretch everything down. Think about head, shoulders, knees, and toes lining up. So in with the nose, exhale, pause. 0, 1, 2, 3, 4, 5. Breathe in, exhale, and we're checking our head and our shoulders and knees and toes. That little bit of exhale at the bottom and pausing is getting this musculature to stretch out. What you're going to see here is very important when we face the device. So if I put on my blackout glasses and I work towards it, okay. So again, not only am I helping with the face, the neck muscles, and a little bit of the shoulder muscles, but as I exhale, I'm stretching and relaxing things, practicing diaphragmatic breathing. No movement on my shoulders, all down here. You can see, here I am checking them about 12, a little bit more away, but I can feel the warmth from it, and that's pretty good. In addition, if I were laying flat, I could put this and do my head, again, 6 to 12 inches away like we do in the bed. We've noticed that it definitely helps with hair growth. If you're laying flat, you can put it on your feet. If you're laying flat, you can put it in the side of your leg and stuff. Just put it on a nice sturdy base so that we don't have any problems with it slipping off. The R1 and the R3, we can adjust them. We can change. We got a timer. We can use them in all different parts of our body a couple times a week, and it's been proven safe. With my clinic, these are some of the treatments. I've showed you how to use them, and I do wish you the most success possible, and stick with it. Just take it easy at the beginning if you need to, but as soon as you can, try to work in full body sessions and see the real benefit, the rejuvenation at a cellular level that red light therapy offers. Thank you to the makers of R1 and to all those who are helping us move red light therapy forward into the future to help all of us. Good luck. Take care. Dr. Bunge saying thank you.